let's continue on tracheostomy complication. Now there is a very important complication I want you to be aware. Usually happen after 48 hours from the placement of the tracheostomy tube. Also can happen months after that, just not necessarily, but usually not in the first 2 days. If you start seeing brisk red blood coming from the tracheostomy tube, call the surgeon right away, as soon as possible. Why? That's the first thing you should do. Call the surgeon, because this could be secondary to what we call tracheoinnominate fistula, which basically the artery, the brachiocephalic artery, gets eroded, and that can happen from a ill-fitted long tracheostomy tube, too long, or the tracheostomy was made in the neck. Let's say this is the neck, low in the neck, lower than it should be, or the tube is too long. Anyway, if that happens, usually you see brisk red blood coming from the tracheostomy tube. So that's one thing. Anytime you see blood coming, especially bright red blood coming from the tracheostomy tube, call the surgeon as soon as possible. Now, sometimes this will come and go, like intermittent. Also call the surgeon as soon as possible and say, oh, it stopped, because that could be just a warning sign about this complication. So it's better to catch it early. Things that you could do until that happen is basically you can replace the tracheostomy tube with a longer one and overinflate the balloon. Let's say you have one here, you get one here, and overinflate the balloon to create a tamponading effect. Sometimes you can put your even finger, get a sterile gloves and put your finger, try to create any tamponading effects until the surgeon gets arrive. Also be prepared and have low threshold to re-intubate the patient using an endotracheal tube, because most of the time this is a life-threatening bleeding. The patient needs to go back to the OR as soon as possible, and mortality is really high with this complication. Remember, it can happen as early as 2 days, but it can happen months after that. Other long-term complication that can happen is tracheomalacia, tracheal stenosis. Tracheal stenosis can happen after decannulation. When I say decannulation, that means removal of the tracheostomy tube. Tracheoesophageal fistula, also that's another complication. These kind of complications with long-term tracheostomy tube, and most of the time we don't see them. I don't think they are that common, but this is the one I want you really to be aware of and know how to manage. The first thing, remember, call the surgeon as soon as possible, then go through the ABC, stabilizing the patient, tamponading effect if you can, type and cross the patient so you get blood transfusion ready, and re-intubate. I would typically, these patients, to be honest with you, I may go ahead and re-intubate them right away. Luckily, this is not a common complications, especially if the tracheostomy tube placed by somebody with a good expertise. Next video, we're going to talk about placement. Patients with tracheostomy tubes on mechanical ventilation, do we keep them in ICU or we transfer them somewhere? We'll find out in the next video, and we'll talk about the decannulation process as well.